Walking in today, it kind of felt like home again. Seeing friendly faces, greeting us with a smile, the past year has been an ordeal.
We found out that Cal was going to have a heart defect. He also had Down syndrome. So we knew ahead of time that we would be facing some challenges when he was born. My OB told me that Med City Lewisville was able to handle everything when he was born. I went to my normal checkup on a Friday afternoon, got off work, rushed down to the high-risk OB, and she didn't like what she saw as far as the health of the placenta and the blood flow to Caleb. She instructed us we should proceed directly to Med City and get checked in, and that I would be there for at least 2 weeks trying to get him as big as he could be before he was born.
Kristen was actually admitted from clinic a couple of days before for observation due to some concerns on the ultrasound, and she stayed in the hospital over the weekend to monitor his heartbeat.
We went in for an emergent C-section really early in the morning on Mother's Day.
The NICU team had arrived promptly, and they were ready to receive Cal once he was safely delivered, and they took his care from there and stabilized him for the move to the NICU, and then continued taking excellent care of him while he was in the NICU getting ready and gaining weight.
We were at Med City Lewisville for 8 weeks, and the care that we got there was phenomenal.
The staff, boy, they were so welcoming to accommodate our kids. We got a lot of friends in the area. They would accommodate friends coming in, checking on him, checking on us.
We were transferred to Med City Children's in Dallas. He was struggling to drink from a bottle enough to sustain him with his heart defect. It just made it really hard for him.
Because of the relationship that we have with Medical City Lewisville, it was a very easy transfer when he was ready for surgery. In fact, he was transferred to Medical City Dallas for placement of a feeding tube so that we could kind of buff up his weight before his open heart surgery that we had planned for somewhere between about 4 and 6 months of age. He also required something called cardiac catheterization. Due to his prematurity and some intrinsic lung disease, we wanted to be sure that we understood the pressures inside his lungs and the hemodynamics that he had. And so our team here at Medical City Children's Hospital, not only do we have a team of congenital heart surgeons, but also interventional cardiologists who can get that data for us so that we can go in to do the safest, most efficient operation that we can.
I'm just incredibly grateful that he's here safe, that I'm here and healthy. It was great. They treat us like family, friends.